Here at Southern DHB, the introduction of rapid rounds has been a really positive thing. The thing that I think we're most excited about is getting the team together, an interprofessional team, to really talk about what's happening for our patients. And as a result of that, we believe that patients are getting better care.
Patients tend to get much better coordination of their care because the staff communicate with each other directly. When those staff then visit the patient, there is a much more consistent message. And staff will see the patient often in the correct order. And the other great benefit for patients is that there's a lower length of stay for them, and often they can leave hospital early the next day because there's been greater coordination the day before at rapid rounding. Patients will often leave the hospital before lunchtime.
I think the key thing is to have everyone involved so that you have a plan for the patient. And that makes a difference. It means that we can plan discharges, and it means then for allied health they can prioritise their work.
Here in Children's Ward we established a huddle as part of the Releasing Time to Care program, and whilst other people might call it rapid round, we've stuck with huddle. It's multidisciplinary, so everybody attends. At that stage we do a quick run through of every patient on the ward, and we establish when they're going to be going home and what it would take to go home. So that might involve getting the physiotherapist or the occupational therapist or the social workers to see them, and with that we plan going forward for the rest of the day or the next few days.
Rapid rounds are helpful because they create a clear plan for the day, and they're beneficial by getting everyone involved, just creating that collegial environment where everyone can kind of give their input on a given patient and everyone feels free to express concerns or things they need to do for the day. And just having that clear plan for the day is really helpful going forward so everyone knows what they need to do.
Look, I've been so impressed with the rapid rounds that I've seen where all members of the team are together, medical, nursing, allied health, and it's really strong leadership, and they're focusing on addressing all those avoidable delays and also making sure a plan of care is in place that really values patient time.
On the medical ward, I think our rapid round works particularly well because we have quite a focused approach, and it's looking at not only what medically needs to happen for the patient to be discharged, but also, you know, all of the different allied health outcomes or different interventions that need to be ticked off for them to get home in the best way.
I think the biggest challenge is people attending, but knowing their place and their value in it. I think on this ward in particular we've worked really hard about the value of it and how it does improve communication within the ward. I think though on the flip side we also need to be open to that constructive criticism and moving forward and being open to new ideas.
And so if we look at the benefits to our medical staff here in Southland Hospital, there's much better communication between the staff, and there's much improved collegiality, particularly between the doctors, the nurses and the allied healthcare staff, because they get to meet every day face to face. They get to know each other better. I also find that there's a lot less time being wasted calling people up to see what they're thinking, and also reading the notes as well to see what other people have done. And one of the greatest benefits is actually people are able to prioritise their work better. The house surgeon is able to do the right discharge summaries first. The physiotherapist is able to assess the right patient first. And this all lends towards earlier discharging and faster care.
We didn't get a really good sense of what the plans were for people, what the barriers to discharge were and when we were expecting to discharge them. Now with the rapid rounds we get the medical staff involved and we have the full MDT there, so we get a clearer sense of how we're getting people discharged and what the plan is for the day from the outset, then we can work on it through the rest of the day.
It's all about communication. You know they say it takes a village to raise a child. Well, in a hospital it takes a team to care for a patient through their journey, of many people, much more than you think, and we have to have ongoing, organised, structured communication so everyone knows what's happening.
The main benefits, I think, of a rapid round and that I've seen is that it improves that patient journey from the time they've been admitted to the time that they go home, to ensure that there are clear aims or goals set for the patient, and those have to be achieved each day, and if they aren't being achieved, why aren't they being achieved? Some of those are around achieving an early discharge, and the early discharge we can use a criteria-led discharge by placing the sticker in the patient's file and setting clear goals.
Attending Rapid Round helps me get a real understanding of medically what's happening for the children, and also really to prompt the nurses about, look, are there any social issues or any concerns that I need to get involved in?
So it has improved communication 100% on the ward. Everybody's here, everybody knows what's happening, there is a plan, and I truly believe it has improved teamwork 100%.
When we introduced rapid rounding in Southland in 2015, we saw an almost immediate dramatic half a day of length of stay decrease across our whole service. And what that's essentially meant is that first of all patients stay in hospital for less time, but also it's virtually increased our bed capacity. And what that means is that our acute patients who were once waiting in ED for a bed can now get to our ward much more quickly. Patients for elective admissions can now find and access a bed much more quickly.
We're really excited at the changes that rapid rounds have made in terms of improving teamwork and communication.